Hi, today we are going to show you a case of fat grafting. Fat grafting we are doing in this case for the face, wherein this particular patient has a rhombus disease, wherein there is a facial fat atrophy. So in such cases, the fat disappears from the face, giving a very shrunk and an older look. So in such cases, we can take fat from other part of the body and transfer it to the face. Now, when it comes to fat, fat is also called a liquid gold. We have been using this fat for multiple purposes. Like we can volumize the area. It can be a face, it can be a breast, it can be the butt area. So multiple voluminizations can be done. Second, we can use this fat in the form of nanofat, which could be used for rejuvenation purpose, like more of like in the treatment of scars, acne scars or other surgical scars. Although we can use this for stretch marks, we can use nanofat. So this fat grafting, when it is a smaller area like the face, we can comfortably do it in local anesthesia as a daycare procedure. So in this particular patient of mine, I am going to remove fat from her abdominal area. I have already infiltrated local anesthesia, waiting for it to start acting. I'll be doing syringe technique because fat, when we are extracting for fat grafting purpose, need to be done very delicately. So I'll be using 20 and 10 ml syringes and will be taking the fat from the abdominal area. And this fat, with the help of small cannulas, I prefer to use 0.8 to 1 mm cannulas and transfer this fat to the face. Now this fat grafting to the face is an excellent technique, has minimal side effects. With the downside of there will be a swelling on the face for up to 1 week, following which it settles down and the result lasts for much longer duration. So let's see how do we extract fat. You can see the patient has already been prepared, draped, we have infiltrated local anesthesia. Fat I prefer to take from the lower abdominal through an incision at the side. And as you're seeing, I'm using a 20 ml syringe on a manual cannula. So we'll be extracting fat like this. You can see patient is totally painless, pain-free. She doesn't feel anything. So with gentle movement, we'll be extracting fat. So you can see we have collected the fat in our 20 ml syringe. So the way I process fat is I just leave it for decanting. Once the saline and the fat is separated, we discard the saline and use the fat. So you can see in this cylinder the saline has been decanted, which I will be discarding and using only the fat component of it. So you have seen how I have harvested the fat and the fat is ready to be transferred to the face. Now I am giving local anesthesia to the face area. So I just want to mention here, fat grafting is a very skilled procedure. It has to be done in a sterile environment by a qualified trained plastic surgeon. There are a lot of complications which can happen due to fat grafting, which we need to keep in mind. So let's see how we transfer fat to the face now. As you can see now, it's already started to reshape. There is filling which has happened here, and this area which we have not filled, you can still see the hollowness. You can see how beautifully this area has got filled up. Even her nasolabial fold is started to fade away now. So we need little more fat here, but otherwise you see it's shaping up well.